Welcome to another episode of the Bandage podcast, a weekly wrap-up of the most trending healthcare news. Each week, join me and my co-host Alex Ross as we'll discuss the latest in healthcare, health IT, and compliance. In this week's episode, we cover an Apple Watch insurance benefit, next-day delivery on medicine, millennials' mental health, and links to lower rates of death. Let's wrap things up. This is episode 2 for the week of October 14th. I'm Matt Moneypenny.
And I'm Alex Ross.
Before we get started, our diagnosis code of the week is Z63.1, problems in relationship with in-laws.
Matt, you'll notice that one's kind of short compared to some of the other ones that are just, many more numbers and letters. It's because it happens all the time.
Right.
And of course, it happens to me all the time. With Thanksgiving coming up, Christmas shortly after that. I don't technically have in-laws yet. But, I'll be seeing a lot of the future in-laws.
Mm-hmm.
I can expect some challenges on how I prepared my turkey this year.
Correct. And this isn't labeled as an initial encounter because it's actually an every single holiday encounter. That's the facts.
Yes, this is recurring. This is chronic.
Ongoing chronic pain from the in-laws.
The real question is, which doctor is it that's typically going to be billing with this code? Is it going to be my therapist, or is it going to be the triage ER doctor when I lose my mind and end up there?
All right, well, with that, let's get into the news. Our first headline here is Apple Watch gets covered by insurance. Devoted Health is the first to offer Apple Watch as a benefit to members. The startup insurer targets seniors with its private Medicare plans. It will pay up to $150 for the device for its members. Apple has been working with insurers and plans like Devoted for months to subsidize the cost of Apple Watch. Alex, I think this is kind of a trend that we're going to see in the future, and I think Devoted Health is kind of making a step in the right direction, obviously because technology can help healthcare in many different ways, but also because Apple Watches are so dang expensive.
That's true. They are very expensive. I guess my question in terms of this kind of move into wearable health type devices, why the Apple Watch? I mean, I myself, I have a Fitbit, so I certainly understand the appeal for having something that can monitor vital signs and, things like your steps, your heart rate, how you sleep, and things like that. But I feel like the Apple Watch does way more than that, and if I were a health insurance company, I don't know if I would really want to go that far. Like, why do I need to give my insured people the ability to text people from their wrist?
Right. I also think that since their targets are seniors and they deal with Medicare, do you think that the seniors will even know what is being put on their wrist? Or do you think they'll get offended because this might be something that's like a mind control government device?
I can't see the mind control being a huge issue, but I can see, if my grandmother put on an Apple Watch, God bless her soul, but she probably would take forever to even figure out what it did or how to use it, let alone how to make a positive impact on her health using it.
Yeah.
So I think in the future, we are definitely going to see insurance companies way more interested in monitoring your kind of health vital signs. But I don't know if Apple Watch is really going to be the direction it goes, or if that's just because of the urging of Apple themselves.
Right. And I wonder if there's any kind of privacy issues where it comes to play. It's like, well, you give these senior citizens this Apple Watch to monitor their health and their physicians looking at it constantly. I mean, is that something that can be tapped into by maybe someone who has malicious intent behind it?
Mm-hmm.
So it's interesting.
Free next day shipping on healthcare? CoreMed introduced its next day delivery for pharmacies and patients in Dallas to meet greater demand of healthcare items such as prescription medications, vitamins, supplements, eyewear, and natural medicine. Delivery is free to the pharmacy patients and will only cost pharmacies $7.50 per delivery with no hidden costs. Pharmacies and customers can track deliveries by text messaging, and all medical information stays confidential with CoreMed's encrypted software.
I think this is kind of like a push. I mean, this is something that we're going to see more and more often. Like I said, similarly to the technology, this is something that I think CoreMed's trying to do to maybe get picked up by Amazon's new healthcare push, because they kind of did that with Alexa. They teamed up with a bunch of already healthcare providers. And I think that CoreMed is trying to create this logistics already and be like, hey, Amazon, we're doing this already. You should partner with us, rather than Amazon having to do it themselves.
Sure. And I could see Amazon wanting to get into that space, obviously. Could you tell me a little bit about Alexa, though? Because I can't really remember all the details about what she's now able to do off the top of my head.
So Alexa has these healthcare tools now where people can ask questions like, hey, Alexa, what's the status of my prescription, or something like that, where basically Amazon teamed up with all these different healthcare companies to have these add-ons where you just go into the Alexa app, you click, I want this healthcare app, this healthcare add-on, this tool to do different things. And it's basically just Amazon's big push into healthcare for the first time ever, using a voice app. Now, obviously, there could be some privacy issues with that as well, because, I mean, if you're talking over your voice and Alexa responds and says, hey, your hemorrhoid cream is on its way, it gets kind of strange. So
sure.
But that's kind of where Amazon's been, and I think that they're going to try to push more into healthcare because, I mean, that's a huge market that they could tap into and just make even more money for Mr. Bezos.
Sure. With healthcare really embracing all of these different technologies, how long do you think it'll be before I can go to a Alexa therapist over Thanksgiving break for a bit of a reprieve?
Yeah, go to Alexa and say, Alexa, I have problems in my relationship with in-laws. And she goes, oh, that's billing code Z63.1. I know exactly what to do for this. Maybe that could happen in the future. But I think, to bring it back to the topic here, I think CoreMed, that's basically what their strategy is behind this. I mean, it's definitely cool. I have had services where they do mail-based delivery services with pharmacies, and it's kind of hard to time up because the only time that you really want your prescription is when it's running low and there's only like 2 or 3 pills left. Mm-hmm. So if they could do next day, that would be great.
Do you think that there's some kind of limitations on which medications or medical devices they're going to deliver? Because I can imagine a very severe challenge with controlled substances of any kind being delivered to your doorstep. I mean, packages get stolen all the time.
Yeah, packages get stolen. And then also, I mean, maybe they would even rob the delivery trucks. I mean, it could get pretty intense if it gets to that point. So I'm not exactly sure. But I mean, that's definitely a good point because I've had my Christmas gift stolen off of a porch when I lived in college. So I could certainly see that becoming a thing.
Yeah, I'd like to see what kind of ways they're planning to combat that. Because obviously that would not be a good result of medical deliveries.
No, not at all. Next topic here, millennials suffering from mental health problems. Recent reports found that major depression diagnoses are rising at a faster rate for millennials than any other group. Since 2013, diagnoses jumped 47% for millennials. Deaths related to drugs, alcohol, and suicide are also higher for this generation. Factors related to millennial mental health issues are financial problems, loneliness, and burnout from the workplace. Over half of workers say their job is negatively affecting their mental health, that their company's mental health benefits are fair or poor, and that they've left their job for mental health reasons. Alex, I mean, mental health is a huge issue right now, and I think a lot of it has to do with not only the pressure put on millennials from a financial and loneliness and burnout standpoint, but I think the key thing here is the two first ones is financial problems and loneliness. Sure. I mean, financial problems obviously come from how high college debt is, and then loneliness comes from that FOMO, or fear of missing out, from social media.
Sure. I'm interested by these statistics. Let me play devil's advocate here for a minute. We could, kind of leaving out the results that we know that abuse of drugs, alcohol, and that suicide rates are higher for this generation. But in terms of an increase in mental health diagnoses, do you think that perhaps that is directly related to kind of the prevalence of the discussion around mental health? Like, my father's generation wouldn't have sought help for mental health, and they would have just suffered in silence. And do you think that that's kind of contributing to that rise in percentages, and it's not really as high as it kind of seems at face value?
I could definitely see that. I mean, obviously, mental health, everyone's like, oh, you got to talk about your mental health. It's so important. And I mean, it is important. So that's definitely a good point. But I also think that millennials in general, I read an article recently that said millennials are feeling more and more pressure to be perfect in every aspect of their life. And a lot of that has to do with something like social media, right? Where they go on social media. This person's a beautiful person. They're super successful. They're very smart. They're very funny. Check out this design that they're going into, right? If they're a designer, they're the best designer ever. And people see this and they're like, okay, I'm starting out as a digital designer. I'm starting out as a talent for YouTube or anything like that, and they don't really see that beginning where you're struggling and you're trying to get to that audience and you're trying to get popular, right? So they just see the end result, and that kind of forces people to think, oh wow, I'm really not good at anything that I do. So I think that kind of has a portion to do with it as well. We've never been as connected as we are currently today. So
sure. And that connectedness even goes into that kind of loneliness that we're spending our social time online, which isn't providing that same kind of benefit. And I say we because I'm very much millennial.
Right, same.
Though in terms of their definition of their mental health benefits as being fair or poor, I wonder if that's not entirely true, because that is based on what they think. How do you feel about those, whether or not they're actually good or not? Because I can say right off the top of my head, I'm not exactly sure what mental health benefits I have. Yeah. I don't know what my insurance covers. In fact, I don't know what my insurance covers on anything. But if you ask me, hey, how are your mental health coverages? I'm going to tell you, I don't know, probably not very good.
Right.
Because I don't know about them. How is my coverage for breaking my leg? I don't know. I assume it's included because that's what's included in traditional medical insurance. So I'm wondering, as we kind of go through time, if we're going to see, well, first, a little bit better education on what your insurance actually covers. But also, I feel like a lot of the major insurances are starting to offer a lot of these benefits. And because it's new, we just don't really know it's there.
Right. Yeah, I could definitely see that as well.
So to anyone tuning in, make sure your fellow colleagues know what benefits they have. Certainly, it's important to take care of your mental health as much as your physical health. So
agree. And if you're running a business, make sure you tell your coworkers and your employees what they can and cannot do in terms of mental health days. I mean, that's very important.
Next up, tying the knot is tied to living longer. In contrast to our opening segment, a new study from the National Center for Health Statistics found that the age-adjusted death rate for married couples declined by 7% from 2010 to 2017, and that rate is declining more than any other group. The study looked at those married, never been married, divorced, and widowed. Married people had the lowest death rate for both men and women. The death rates for divorced and never married people were similar, and the rate for widowed people was over double the rate for those who were married. Perhaps the trouble with in-laws each holiday season helps keep you going longer.
Yeah, apparently. I mean, it makes sense that people who are widowed was a little bit double in terms of the death rate than those who were married. Never married or divorced, because, I mean, if you lose your love of your life or that soulmate, obviously you'll never be the same again, right? So that kind of makes sense. I think just saying that married people live longer and then also saying that divorced and never married people's rate were similar is, I mean, it kind of counterintuitive, right? Because, I mean, it's basically just saying, hey, death rate is declining in general. Yeah. That's basically what this is, but just with a spin on marriage.
It is interesting that married people seem to live longer, and maybe that's a mental health benefit.
Yeah, it kind of goes back to that last topic, right? Is they're not lonely, so they have a reason to live, and maybe they don't have any financial problems or as much financial problems because of that double income.
Yeah, certainly when I'm 85 years old, if I don't have anyone to play bridge with, it's going to be a sad and lonely existence.
Right, and millennials who are married, a lot of them, I mean, obviously the birth rate for millennials, like having kids, is going down. And I think because they get that double income, they're called double income no kids. They're called dinks. and that is a very popular way to live your life now, especially within the millennial generation. So,
well, I have kids. They're dogs. But
oh,
no,
yes,
I'm just kidding.
Right.
One day. Speaking of dogs, though.
Owning a dog reduces risk of death. Researchers found that owning a dog was associated with 24% decreased risk of death among the general public. Heart attack survivors who lived alone had a 33% lower risk of death in the first year after a heart attack if they owned a dog, compared to those who didn't own a dog. Loneliness and sedentary lifestyles are risk factors for premature death, but owning a dog provides companionship and motivates owners to walk more by walking their dogs.
What a great service these dogs provide for us.
I wonder if there's one for cats, right? Because I don't think cats really give that companionship because they're kind of doing their own thing and just knocking stuff over the table.
Yeah, I have to say that my dogs, in this article, it's talking about the companionship and walking your dogs. But I think it gets even more basic than that. In the morning at 6 a.m. when I don't want to roll out of bed, I just want to lay there. They're going to make me get up,
right?
Or they're going to make a mess on the floor, and I know that. So every morning I get up so that I can take them outside, and that keeps me on kind of a regular schedule where I'm waking up at a similar time, and I really don't have an option. I got to do it, but I like them, so it's kind of worth that sacrifice to me, and I think that kind of goes into it. It's that routine. It's those healthy habits that having your companion animal, your dog, does for you. Now a cat not so much, because you don't have to get up and take them out, but I guess they do still get you up every day at the same time.
Yeah, right.
It's just 2 a.m.
Yeah, and they still do give, I'm sure cats still give some form of companionship, but I think you're right there. I think it motivates you to wake up in the morning and have that regular schedule, and it makes you get up and walk around, whereas you're not just going to sit there and watch TV for 6 hours, because your dog's going to have to go outside and you're going to have to take him for a walk. And he's going to let you know, because he's going to be super active and hyper and jump on you, or he's going to make a mess in your room, right? So I think that's kind of interesting.
Yeah, I can't really speak for everyone's dogs, obviously, but I know my dogs, if I just kind of like sit there, watch TV for a little while, then they're going to be like, it's dinner time.
Yeah.
And you're going to get up and feed us. And if I don't get up and feed them, then they're going to make sure I know that I should be getting up and feeding them.
Right.
So
exactly.
They kind of keep me moving, keep me active. And let's face it, the reason I go to work every day is so that I can buy some dog food.
Right. Yeah. That expensive dog food, the top, the top of the line
dog food that millennials are buying nowadays.
Yeah. I just give my dog steaks, just T-bone steaks every night,
every day,
medium rare. It's his favorite.
No, not going with the raw diet, huh?
No, he likes cooked meat, so how it is.
A little bit of garlic salt.
Yeah. Alex, what kind of dog do you own for the audience?
I have 2 dogs. I have an Australian Kelpie, and I have an American Dingo. So
wow.
If you don't know what that is, look it up. It's pretty cool. Also known as a Carolina dog.
Oh, Carolina dog.
Yep. Because
but they have an Australian name, Dingo.
Yeah. Well, it's because they're if you will, a wild dog.
Wild, yes, of course. I have a Siberian Husky, so
wonderful.
Yeah, wild.
One of the best. If I wasn't afraid of it escaping out of my backyard, I'd have one too.
Yeah, right, exactly. Those Houdini dogs is what they call them. With that, let's go into our next segment. BREACH, Breach Patrol. It's a breach! All of the latest cybersecurity breaches. Welcome to our segment, Breach Patrol, where we cover all the latest cybersecurity breaches in the entire world.
First up, The Count, more like counting dollars. Volusion, a provider of cloud-hosted online stores, was breached this week. The breach affected more than 6,500 stores. The hackers delivered malicious code that recorded and stole payment card details entered in online forms. The most notable compromise is the Sesame Street Live online store.
Wow, Sesame Street Live is getting hacked.
Big Bird t-shirt and your identity stolen.
I'm going to learn my ABCs and I just lost my credit card number.
I'm going to learn how to count as high as I need to count the losses from this breach.
Yeah, I think the biggest takeaway here is hackers are just going for anything at this point, right? It doesn't matter if it's a kids show that everyone grew up watching or your healthcare, right? They're going to go for that data because it's easy pickings. 6,500 stores is, that's huge.
Yeah. And that's not going to be a good look for that company, obviously, because the company that was breached is the one hosting all of these different stores. And I could see them not lasting too much longer should this result in something more significant than just the fact that a breach happened.
Yeah, and one of the things to take away from all these breaches, and it's just not in this case, right? But these ransomware, if we go back to ransomware, it's growing exponentially just across the board, but mostly with healthcare. And a lot of times hackers kind of rally behind ransomware attacks because they're viewed as the Robin Hoods of modern day, right? Because they're attacking these companies that are usually have a negative connotation associated with them. Now, obviously, this isn't the case for this because number one, it's not a healthcare company. And number two, they're hosting for Sesame Street Live. I don't think anyone has any negative connotations with that, but it's just something to keep in mind.
Just becomes which fish is the easiest catch.
Right. Yeah, exactly.
You gotta cut your teeth somewhere, I suppose. I think as we kind of progress into a more and more technologically connected society, that kind of thing is going to become like the new street crime.
Yeah.
You know, people aren't robbing you on the street, they're robbing you online. And that's just kind of a transition as to where we keep our wealth and our information. You know, it's in my wallet, so you could take that, get my name, my social security card if I carry it, which I don't because it's a bad idea. Don't do that. But a lot of people do. Now it's kind of like, all right, that information is also on Sesame Street Live because I just bought my 4th pair of swim pants that have, you know, Elmo and Grover on the side. And so that's just, you know, where is the information? It's on Sesame Street Live. It's in my wallet. It's, you know,
it's
with
everywhere.
my healthcare company. And it's each of those avenues which all kind of provide a similar outlet for hackers. You know, that's what they are. Hackers are modern day street robbers.
Yeah. Next headline here in Breach Patrol is EA Sports gets kicked down by FIFA 20 breach. Shortly after EA opened the registration portal page for their FIFA 20 Global Series, they were hit with a breach. When new users were trying to register, they saw personal information of already registered users. The page was asking them to confirm details that were not their own, including usernames and dates of birth. The breach affected about 1,600 registered players. EA quickly addressed the issue and temporarily disabled the page. I don't think this is necessarily a malicious attack. I think this is just kind of an oversight by EA.
Yeah, that's what it's sounding like. Certainly it's a breach because people who shouldn't have seen personal information saw personal information.
Right.
The difference, I think, here is where did this breach come from? And to me, it sounds like it may have just been, whoops, we programmed that really wrong. And it was autofilling with other people's information.
Yeah, I think, EA's big shtick is getting people to pay within in-app purchases. So I think they're lucky that they didn't have credit card of these users exposed. It doesn't seem like from this article that they were exposed other than just the usernames and dates of birth. Now, obviously, if there's dates of birth, then there's probably actual names and maybe street addresses, but it's like standard protected information. But it doesn't seem like it was that terrible.
Certainly. Do you think this is going to result in a penalty